If you've ever felt overwhelmed or even misled by Medicare Advantage marketing, you're not alone. A new national report collected real stories from people on Medicare, and many of them said the exact same thing. The marketing that they received did not match the plan that they ended up with. And while that alone is concerning, something else is happening at the exact same time. Hospitals across the country are now raising their own alarm about Medicare Advantage. And the concerns that they are describing line up exactly with what the beneficiaries are experiencing themselves. Hey, real quick, I know the Medicare enrollment season for Medicare Advantage is now already closed. However, I want to make you aware there's a do-over period. That's January 1st until March 31st. You can redo whichever Medicare Advantage plan you selected. As long as you're already on one, you can change to a different one. So if you find out right after January that what you signed up for is not what you expected, there is a solution to that. We can help you. It's at seniorsavingsnetwork.org/MAOEP for the Medicare Advantage open enrollment period. That's January 1st to March 31st. We'll see you then. So today, I'm going to walk through both stories and show how they connect and explain what this means for anyone trying to understand how Medicare Advantage actually works. The first report comes from the Medicare Rights Center. They're a nonprofit that runs a large Medicare helpline, answering calls from across the country. They answer thousands of calls from people trying to fix enrollment problems with Medicare Advantage. They're trying to understand their denials that they've got. They're trying to make sense of the marketing that they receive because they don't line up with how it actually works. And in this latest report, the theme is clear. People saying that the marketing that they saw and they heard for the plans, they sounded official, they sounded urgent, and they sounded like the benefits were guaranteed. They thought they were speaking with Medicare themselves because of the tone of the outreach. Others saw the advertisements that promised benefits that sounded like they were automatic, without explaining the rules or the limitations that would decide whether they actually received that care. Confusion. Not confusion about Medicare itself, but confusion caused directly by how Medicare Advantage plans were marketed to them in the first place. One of the most common problems was the expectations don't match reality. Benefits and ads that were described as automatic or guaranteed without mentioning that approval depends on whether the networks are still in the network, prior authorization is approved or not, medical necessity determined by the plan. Some callers said they were rushed into an enrollment and didn't have the time to check whether or not their specialist or their medications were included. Others said that they learned key doctors were now out of network only after joining. A benefit that they thought that they were going to receive turned out to require prior approval, which we've talked about. They didn't know that. The report does not say that all marketing is misleading, but what it shows is the style and the volume of these messages create a real risk of misunderstanding during the short enrollment window. Now, here's where the second story becomes important. While beneficiaries are reporting this confusion and unmet expectations, hospitals are reporting that something that mirrors that, but on the provider side, from a different angle. Becker's Hospital Review recently published comments from hospital leaders across the entire country. Many were asked what the biggest issue is with Medicare, and they said Medicare Advantage. Their answers were remarkably consistent. Hospitals said that they're facing high rates of denials for care that physicians believe is medically necessary. They said that prior authorization has expanded far beyond what they saw even just a few years ago. Some described long delays in getting approval for just routine services for the Medicare Advantage people while they don't have that on original Medicare. Others said that they have teams of people spending an enormous amount of time appealing Medicare Advantage decisions that used to be simple. Several leaders actually said that traditional Medicare payments are more predictable, while Medicare Advantage includes uncertainty and administrative pressures that both affect the hospital and ultimately the patient. When you look at these two reports side by side, a clear picture emerges. On the front end, beneficiaries describe marketing that highlights extra benefits and all the convenience of 3 plans all in one, but leaving out the rules that determine whether something's going to be approved or not, or even in the network. On the back end, hospitals describe those same rules, causing delays, denials, and confusion when patients arrive for care, and the hospitals are stuck in the middle. Both groups describe the same gap, the gap between the expectation created at enrollment and the reality encountered during the treatment. And what that marketing emphasizes and what the system requires are not always aligned. Beneficiary feels that when something's not covered as they expected that it would be, the hospital feels that when the doctor recommended care, it's denied and delayed. So what does it mean for someone trying to understand Medicare Advantage today? First, it means that marketing alone is not enough information to make an informed decision. Marketing is designed just to get attention, and then you have to do your own research. It's not designed to explain approval rules, denials, network structures, how specific plans will handle your medical needs. And secondly, it means that the real experience inside the plan depends on details most people never get during their enrollment. The network, the authorization rules, the referral requirements, and the coverage criteria used by the plan for treatment. These are the factors that hospitals are pointing to when they talk about denials. And these are the very factors that beneficiaries rarely hear about in advertisements. Understanding these differences do not require taking sides, whether you like Medicare Advantage or you don't. It simply means recognizing that there are two very different experiences happening in the system, and both matter for the patient. Here's something that the two reports make clear. Even though they never said it directly, most Medicare Advantage frustrations do not happen because someone chose the wrong plan. They happen because they did not have enough accurate information to choose the right plan for them. And the gap between expectations and reality is where people get hurt. That gap is exactly what both beneficiaries and hospitals are describing in these two reports. And you can find the reports in the description of this video. If you found this helpful at all, take a moment before your next enrollment period ends to slow down and review the coverage. Read the summary of benefits. Understand how your plan handles your care. Awareness is one of the strongest protections you can have. And that's why you need, in my humble opinion, an independent agent that knows the industry and studies it every day, gets certified every year to understand these plans and actually does it as a profession. So get some professional help. We'd be glad to help you over here. Have a great day. Thanks for watching.